Hello friends, in this video we will talk about TMJ, applied aspects and a short note on the pterygoid venous plexus. So AN33.3, 33.4 and 33.5. So what are the objectives we are going to talk about? We'll identify introduction, TMJ, pterygoid venous plexus, the clinical significance and the applied aspect of TMJ. So what is this TMJ first of all? So it is a joint which is formed by the mandible and the temporal bone. This is a condylar variety of synovial joint. Okay. And this moves the mandible for mastication and speech. Mastication as in chewing the food. Okay. So this is to show you an animated picture of how the TMJ works. You can see that the mouth is opening and closing with the help of the muscles of mastication. We can see that very well. Okay. Now, it has these articular surfaces, upper and lower. Upper, we have the mandibular fossa in the temporal bone. Lower is the head of the mandible. So that's what articulate to form the TMJ. Let us see with now the movements of the mandible and what are the muscles which are acting on it. So we have 5 important movements: depression, depression, elevation, protrusion or protraction, retraction and side to side movement. So depression is done by what? Lateral pterygoid, digastric, geniohyoid, mylohyoid. Elevation done by masseter, medial pterygoid and temporalis. Protrusion is done by the pterygoids, that is the medial and lateral pterygoid. Retraction is by posterior fibers of temporalis and side to side movement by the same pterygoids only. Now, applied aspect, let us see with the TMJ dislocation. So this is our normal TMJ, we can see here. This is the dislocated TMJ. So the mandible is dislocated from the mandibular fossa, and this is nothing but commonly anterior dislocation. Now, TMJ dislocation, the same thing I told you, but these are little extra points. It occurs due to the following factors. The paralysis of lateral pterygoid muscle. This is what opens the mouth. Okay. Fractures of condyle and neck of the mandible. So, in the osteology of the mandible, I will tell you in detail about the fractures, but just understand for now that the neck of the mandible and the condylar process will be fractured in this case. Now let us see with pterygoid venous plexus. So it is a small plexus of veins, or simply you can say a small venous plexus which is surrounding the lateral pterygoid muscle. So if this is my lateral pterygoid muscle, there will be a small venous plexus surrounding it like this. Okay. What is the applied aspect? Let us see is it is called peripheral heart. Now, have we come across this peripheral heart somewhere? Definitely. We have come across in the soleus muscle. It's a muscle of which limb? Lower limb, right? So, here, beware, soleus muscle is also called as peripheral heart. Okay. So, what do I mean by this important term, that is the peripheral heart? So, during yawning, the lateral pterygoid muscle opens. I already told you. Opens the mouth and venous blood is pumped into cavernous sinus. So there is the pumping of the venous blood into the cavernous sinus and the maxillary veins. And this might be the reason why people feel sleepy when they wake up in the bed in the morning. Wake up from the bed in the morning. This might be the reason why they feel sleepy. So references from where I took these pictures. Now this brings us to the end of the video, and thank you so much. I'll see you in the next video.